Instant courier rates, your trusted partner for urgent delivery solutions tailored to the senior care industry. Hi there, hospice and home care leaders. Today, we're diving into one of the most important shifts coming to our industry, the Hospice Outcomes and Patient Evaluation tool, or as you'll be hearing it more and more, the HOPE tool. The HOPE tool is a standardized patient assessment system developed by CMS, yes, the Centers for Medicare and Medicaid Services, and it's set to replace the current paper-based admission assessments used in hospices across the country. It captures clinical, psychosocial, and functional data, real-time insights that cover everything from symptom burden to care preferences, all collected by your interdisciplinary team during admission and throughout the care journey. So why does this create urgency for senior care providers like you? CMS is rolling this out nationally starting October 1st, 2025. That's the beginning of fiscal year 2026. From that point on, use of the HOPE tool will be a compliance requirement tied directly to Medicare's conditions of participation. In short, no HOPE tool, no compliance. No compliance, no Medicare reimbursement. It's that serious. This tool will change how your team operates. Period. New documentation workflows, more staff training, greater dependence on technology and clean data. If your systems and teams aren't aligned now, you could face delays, errors, and operational breakdowns down the road. Here's another game changer. Your performance will become public. The data you collect will eventually feed into quality reporting platforms, letting referral sources and regulators see how you measure up to other providers. That's added pressure and a new level of transparency we all have to be ready for. The HOPE tool is more than a data form. It's a step toward a value-based care model where CMS rewards hospices that can show results, not just services delivered. We're moving into a world where impact matters more than volume, and HOPE is the foundation. So what should you be doing right now to prepare? Audit your current assessment process. Are you collecting the right data the right way? Train your team, especially RNs and social workers, on structured real-time assessments. Upgrade your technology. Your EHRs and data systems need to handle this. And if you're still doing manual workflows, now's the time to automate. SaaS tools like ours can help simplify documentation and logistics, keeping your teams compliant and efficient. The HOPE tool isn't just a CMS requirement, it's a wake-up call. And for leaders who take it seriously, it's also an opportunity to improve care, strengthen operations, and lead in a new era of hospice transparency. Don't wait for October 2025 to get ready. The time for HOPE is now. If you want help assessing your readiness or implementing tech that makes compliance easier, visit us at www.instantcourierrates.com. Don't forget to like, subscribe, and share with your network. Until next time, keep your care timely, safe, and compliant.